As communities across the country consider bans and regulations on a synthetic marijuana product known as K2 or Spice, health officials are coming out with warnings of the substance's effects. Joining me this morning is Dr. Deborah McMahon. She is the Allen County Health Commissioner. Good morning.
Good morning.
Now, this seems to be a newer topic around here lately, but it certainly isn't in other countries. So really, health officials already know the effects of smoking this. It's an incense that's sold legally, and people are smoking it. What is that doing to people when they smoke it?
Well, it's an incense, but it's been sprayed with synthetic cannabinoids, so it's having the same effect as the active ingredient in marijuana or pot called THC. So it's increasing heart rate, blood pressure, has a lot of psychiatric effects, makes some people have panic attacks, may have some people have hallucinations, may make some people euphoric. It's really a combination of the effects we see with alcohol, opioids, other hallucinogens. So it's really having quite a varied effect on people.
Now, if it's similar to the effects of marijuana, is it any worse?
The concern is it actually binds more effectively with the receptors that stimulate these responses or these effects in people. So the concern is that actually it will be more potent, and anecdotally they believe it actually hangs around longer in the body. So yes.
And a lot of young people seem to be attracted to this. That's got to be concerning.
Well, it's legal. You know, they can actually go and get it at the convenience store. So, yeah, a lot of people, young people are using it. And the concern is we don't know the impact it has on developing brains. As we've said before, young people, their brains don't mature physically until they're about 25 years old. And we know with our experience with nicotine, for example, the younger you are when you start, the more likely you are to be dependent and the harder it is for you to quit. So it's likely to be the same scenario.
Communities in our area, such as Kendallville and Butler, have already passed or are thinking about passing bans. Fort Wayne is thinking about discussing the issue as well. Do you think that's a good idea?
I do, because again, I think a good policy helps people do the right things and helps it make it harder for them to do the wrong things. And I think really protecting our young folks like this is really good. And it's so encouraging to see Indiana be so proactive so quickly on something that, you know, is of grave concern for our kids.
Okay, well, thank you very much. This is a topic that doesn't seem to be going away.
It's not going away.
I appreciate you coming in to talk further about it.
No problem.